Hey everyone, here's a day 7 update. I'm out driving around today. I actually went yesterday to the grocery store. I feel pretty good, of course, if I'm out driving around. I went to the grocery store today. I just went to get some ice cream from Chick-fil-A. Different than what I have. So, I think this will be a quicker update. Pain level is pretty good. I am getting more pain in the stomach area. Almost feels like a suture, a soreness from the suture, like a stretching. Somebody like stretching, pulling your skin. If that makes sense, but not necessarily just around the areas of the sutures. It's a couple inches away from it. So, but I know they were inside my stomach. So yanking and pulling and moving the scopes around and stuff like that. So I'm hoping, of course, there's nothing major and there's nothing wrong. It's just part of the healing process, and I'm still tender and sore, but I feel good. Diet's no different again than it was on day 6, this being day 7. But the one thing I did check into yesterday after talking to a nurse, and then my wife used to be a CNA, and just sometimes you don't get what you need from the nurses or the doctors, so use Google. My wife because she was a CNA and she worked in a rehabilitation facility, she had some experience with it, and she was thinking, oh, my husband has this sour taste in his mouth and water brash and has foamy saliva, and sometimes it's more watery and things like that. But she also noticed, and I told her too, that my tongue in the back was white. So she had seen thrush before, and she's like, that doesn't look like thrush, it just looks like your tongue's white. So apparently it's something called white tongue, and it's just from bacteria. And because for me right now, I'm not eating, I'm drinking and having mashed potatoes and liquid stuff, that's a cause. And then having dry mouth because you're not drinking maybe as much as you normally would, causes this white tongue. So I go to the store to get mouthwash, a dry mouth mouthwash, as well as a tongue scraper to scrape off the white. And then that seems to have already helped in less than a day. I've done it several times already, but it seems to have helped. And it also has made the water taste better, that sour taste in the water. See, I know I'm so used to the acid reflux, and the saliva and all that other stuff. I'm so used to all that stuff that I thought, oh, my symptoms have just reoccurred, and I still don't know 100%. But again, scraping my tongue, mouthwash, brushing my teeth more often has seemed to have helped. The water doesn't taste as sour, seems to taste more normal, things like that. So I'm encouraged, but very much so. And I haven't had any other symptoms. So just so you know, it sounds like this might be very common, that you might get a white tongue type of a thing and dry mouth. So get some mouthwash, get a tongue scraper, brush your teeth more often, rinse with mouthwash if you're having that, because it sounds like this be common because of your diet, because of the surgery, and because you're not chewing anything, you have nothing with texture, so you're not essentially with food scraping off all that bacteria in your mouth that's helping kill all this stuff in the food or whatever. I don't know, but again, that's something to keep in mind. But otherwise, I feel good. I'm probably not going to do another update for a couple days unless I have a major a breakthrough of some sort, or decline or increase in how I feel. So, but otherwise, I feel pretty good. So anyway, my wife and daughter are just riding the bike and I'm waving. But beyond that, I feel good. The pain levels haven't changed. I feel better, other than the pain I mentioned earlier. Diet hasn't changed. The only other thing was, like I mentioned, the sour taste and the water brash essentially has gone away. I still get the gas bubble, but it's very minor in comparison to what it was. The nurse told me again that's common, but it sounds like it goes away with time. So I'm doing pretty well on day number 7. So likely see you on day 14. Have a good one.